Folks, thanks for joining us today. My name is John Dubas with Premier Marketing, and we'll be spending the next 55, 60 minutes or so discussing a valued approach, a variety of valued approaches on why you need to and how you can sell dental, vision, and hearing programs. The presentation is being recorded and will be made available on our website at premiersmi.com, on our YouTube channel as well, and with your agent marketer with Premier. If you don't have one, we'll make certain that you get one that is a subject matter expert for you. You'll notice in the software package, there's a question for both, or there's a section for both questions and chat. We ask that you use the questions section. We find that most of those are normally covered through the course of the presentation, but we want to make certain we address any inquiries that you have so you get full value out of the investment of your time with us here today. And part of that comes with a bit of explanation up front. We work with a variety of agents with a variety of familiarity with this topic. So for some, this might be brand new. For some, it might be a welcome review. We want to make certain, however, that you understand that and that the detail that is in this presentation can be helpful for you across the board. So when we look at a level set, let's start with who Premier Marketing is. For those of you that are familiar with us, well, once again, a review. For those of you that are not, brand new. We're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. We're licensed in all 50 states, working through insurance agents such as yourself, independent agents as a wholesaler with contracts available at the highest possible commission levels, with recruiting contracts available to those who qualify. We do so through that full portfolio of products aimed at our target demographic. So we have those basic Medicare programs that help cover the shortfall with traditional Medicare, such as Medicare Advantage and Medicare Supplement plans, and of course the standalone Part D prescription drug programs, those PDP plans. But we also have a full portfolio of life insurance and annuity products, final expense life insurance and pre-need plans, along with long-term, short-term, and disability income programs, and the ancillary benefits, such as what we'll discuss today, the dental, vision, hearing programs that are a key way of getting in front of additional people and a key way to help you with the persistency of your business across the board. The other categories, we have different webinars scheduled with them as well. Some may be in our video library already, but watch for those that we do on a consistent basis. When we look at the Medicare Advantage plans, we have the national carriers there for you through our organization, along with many of the strong regionals that can make a difference for you in your market. And that same philosophy carries over into the prescription drug plans, where the majority of these are part of the contract that you have with an MA carrier, that MA carrier in question. A couple of exceptions. Mutual of Omaha is an adjunct contract specifically for their PDP plans, and CleverRx is a discount program, not a Part D standalone drug plan. When we look at Medicare supplement programs, we speak to this with a great deal of certainty that the portfolio is large. Programs are there to help you sell these programs, but this is also a market that generally doesn't have any dental, vision, hearing coverage at all. And so it's important for us to look at our Medicare supplement business when we speak of dental, vision, hearing programs. And in that particular adjunct or in these particular categories, we have the national leaders for you in each of those, including the topics that we'll discuss today with dental, vision, hearing. Specifics on these carriers, well, they're separate webinars. We'll briefly touch on them, but we'll make certain that you realize the availability of the programs in your market, because they're not always in all states. You look at the Medicare market overall, it's a huge market. The aging of the baby boomers, the silver tsunami, 1 every 10 seconds, 10,000 plus a day, illustrates the near exponential growth of folks becoming eligible for Medicare. But we see that number pared down just a wee bit by a number of folks that are eligible for Medicare benefits and defer them for one reason or another. They may continue to work. They may have other coverages that are in play. Whatever it is, That's more than, however, made up for by the folks that are under the age of 65 accessing Medicare benefits for or because of a disability. And these folks are also excellent prospects for dental, vision, hearing coverage because, hey, if they took out a Med Sup, generally it's a Plan A, doesn't have that benefit. If they took out a Med Sup for that are available for them in certain states that doesn't have it. So you have a number of different ways that you can approach this because, well, dental, vision, hearing programs aren't just for the senior population, but that population is huge. We see these latest numbers that we have available for us, and we have a large market to approach that has choices when it comes to what coverages they have. Medicare folks don't even have to take Part B if they don't want it. They can decline it should they choose to do so. Some for very valid reasons. Some, well, it may be just centered on expense. However, the majority of people that go into Medicare look for additional coverages. And that may include self-insuring for some of the medical, but picking up a dental program or a dental program for those expenses and a Part D program to cover their medications. Or they may go the standard route to traditional Medicare, pick up that A and B, and look for help through a standardized, modernized Medicare Supplement Medigap plan. Great prospects for DVH as well. Medicare Advantage programs, the bundling of the benefits all into a singular program, the Part C plans, the all-in-one plans we hear advertised so much. Generally, there's dental coverage with many of these programs. In certain circumstances, though, it may well not be enough. They are also folks to basically ask and get additional information to see if it would be of benefit to them. Because when we look at the choices that people make when they first come available, it's been a pretty even split between Medicare Advantage and Med Sup. Changed a little bit in the last couple, 2-3 years, with a greater emphasis of enrollments into Medicare Advantage plans. We want to make certain then that we are able to discuss with them the programs we offer in a language that is understandable. And hey, every part of our society has acronyms that are pertinent to their part of the world. Medicare, they got a ton of them. CMS's website with the guide that they give us, 4,420 acronyms. We want to make certain we define ourselves, minimize the use of acronyms should we be able to, but make certain that the information that we're providing is clear to the individual and they can understand not only the message, but what some of these acronyms mean. We look at the different election periods and the SEP periods, those special election periods, and we look at the weather programs that are available. Now, these carry over from year to year, and we see that it doesn't necessarily mean that these folks are doing anything for their coverages. Well, when you look at this, dental, vision, hearing programs aren't subject to this type of oversight anyway. You can sell them year round to whomever fits the eligibility factors. And that includes folks that have not done an annual review on their base Medicare plan. That gives us an opportunity to visit with folks that may need dental coverage as a door opener, but that gives us an opportunity then to, well, review their current coverages and see if one of those special election periods are pertinent to the discussion they're in. That applies no matter what the base coverages are. So we have a discussion point across the board, and we find that folks aren't generally using the resources that Medicare puts out there. Some of the wonderful pieces that they have that are recorded or made available on through the App Store, or even through the tried and true Medicare and You handbook, which many folks now get as an e-handbook. Some of it does still go through direct mail, but in each of these categories, they're not necessarily assimilating the information they need or reviewing it at all. And that includes, hey, that's an e-handbook. Well, the government's delivering them information on an electronic basis as well, as is just about every segment of life nowadays. So we want to make certain that the presentation programs that we have are available for an in-person presentation, a virtual one, or that hybrid, because folks in this market are becoming increasingly digitally savvy, and they've been trained through the pandemic to receive care from their primary care and specialists, do some prelim work for hospitals and dentistry, among other parts of the need that they have for coverages. Well, it gives us then the opportunity to work with a population that this can be a review of programs as part of your standard reach out and touch someone that's part of your book of business, or that perhaps you tried to do business with in the past and didn't close the deal for one reason or another. A great way to reach into that population and use some of the electronic tools that are available through these programs to be very efficient in the way that we deliver the information that's necessary for these folks to make a choice. So when we look at why we sell dental, vision, and hearing plans, it's important for us to note that the dental market, when we look at our target population, well, most people go on Medicare, they don't have dental coverage, and they may go without needed care. So you have a lot of folks that are coming on to Medicare that lose their coverage through work or never had it to begin with. Whatever the choice may be, they need help. And we see that many of them plan to go to the dentist, but a much smaller percentage actually visited that dentist as per their intent. And what we want to do is make certain that they realize that the main factor in that, here's my rhetoric, here's my reality, well, biggest thing that made them not do it, cost. And they know they need the care. So we want to make certain that folks that haven't visited the dentist in the past year, or find that the costs that are attributed to the services that they need are much more than they had anticipated, because nearly 1 in 5 who used any dental services spent more than $1,000. And we'll see through the course of some of these programs how that is very easily covered for a nominal cost and gives them additional benefits. So one of the programs that we do fairly consistently is what Medicare doesn't cover, and that includes some of the dental services that many of the folks feel that they're going to have access to through Medicare itself. And we find that much of what they need is not covered by Medicare, hence an added incentive for a person to seek additional care coverage in that area. And realizing once again, of course, they don't have that coverage now, so they need you. If someone is enrolled in a Medicare Advantage plan, in many cases, they have dental coverage. And we see some carriers in certain markets be very, very aggressive in offering this benefit moving forward over the last couple of years. That, however, is not the case across the board, and you will run into Medicare Advantage enrollees where those members need more dental coverage than what they have with their MA plan. So we want to make certain that that same idea, that same need is covered even through some of the dual eligibles that we visit with. So some of the folks on Medicaid, obviously they have a different sort of coverage. Some of the people that are on a dual special needs plans have additional benefits in this area as well for the most part, but it may not be enough. However, the partial duals, the folks that may qualify for low income subsidy assistance on their medications, but not on healthcare costs, very, very much a very viable market for us for dental, vision, and hearing programs. How do we find them? Well, that is some of the things that we do when we weed through our approach for these individuals. And what we find with some of our direct mail partners is the programs that have the greatest return on mail during lock-in, lock-out, whatever you want to call it, are folks that are D-SNP candidates or are looking for dental programs. So these are actually it's a market that gives us additional return on our dollars when we do direct mail campaigns. And it helps these folks because it screens for different chronic illnesses. And this may not be something that many of us think of when we go to the dentist, but it gives the folks an opportunity to perhaps discover some things that, hey, they never talked to their family physician about, or maybe they haven't been to their doctor in a great amount of time. So it will help with discovering some of the physical challenges that they need to address outside of dental coverage. You'll see a lot of folks that all of a sudden become aware of the fact they have diabetes through their dentist, or that they, of course, are a part of the population that has perhaps cognitive decline for dementia. So we got to look at maybe long-term care possibilities there as well, but also an opportunity for us to make certain that these folks have access to the H part of this, which helps with the cost of those hearing aids. We look at vision. Well, this is where we can really detect some chronic illnesses, but it gives us then also that need for the V part of DVH, the vision coverage that can become available. And it's important for us to note that many times these folks will speak to us, these folks, our prospects and clients, they talk about cost and not be aware of what some of what they need cost. So this is a great website that you can actually use with your prospects and clients, where they can find out for themselves, well, gee, that simple visit, not so bloody simple, and it's not so bloody inexpensive either. Probably should not use the word bloody when we're talking about some dental services. Pardon me for that. But it gives us then a way of creating the urgency and the need for the product that you're offering. And what we have is a bunch of folks that are, if you're looking and chasing that T65 market, well, look at that. 71% of employed seniors intend to keep their dental, and they want to visit the dentist every year. Remember that slide back a few days or a few slides ago? And it said, well, the intent is this. What they do the next year, maybe not so much. And it gives us then the idea then of where some of this business may be being placed through what carriers. And that is a decision that we'll talk about in a little bit to find out what exactly you need to have as part of your portfolio and whom do you contract through. So we want to make certain that these folks understand the value of the coverage. Doesn't have to be painful, and it may be just a simple case of asking for the business. You have dental coverage yourself? That's one thing to consider. So when you look at this and we look at the premiums associated with some of these programs and how inexpensive they can be, or a little healthier premium than that, we will find that the folks will go, well, gee, that works for me. And then we want to make certain that they understand how the value of their continued relationship with their dentist can affect their overall health, and how that, once again, can be a predictor of some of the challenges that we have. A question that popped up. I want to make certain that we look at this. Susan asked if these plans are accepted at any provider, or the full benefit only paid if the provider is registered to accept Medicare. Example, my local dentists do not accept MA built-in dental benefits. And that is part of the thing that you will find with some of the MA plans, where it is a network-based program. Many of the standalone programs are not network-based. They pay in addition to any other coverage that is needed. And if the dentists themselves do not fill out the paperwork for you, which they can, they may defer that to you, but if you take your billing and file it, you're going to get paid on this, because it covers regardless of whatever else is part of your benefit package that you've created for yourself. When we look at vision coverage, a lot of times we will pass this over because, hey, I do an annual exam, but my vision's pretty good. I haven't fought with any of the challenges that some folks do with vision decline as we age. However, it is one of the programs that really give us an indication of, well, that person hasn't been to the doctor for years either, but they come in for an eye exam and it helps diagnose some of these other maladies that we're subject to in many circumstances. That gives us then the opportunity to add additional value to the fact that that eye exam is more than just for the eyes. It then makes certain that in those different health categories that are of grave concern to many of the folks we visit with, this is a diagnostic tool to a degree as well. It, of course, does help with the actual vision care and the eyeglasses themselves. When we look at the Medicaid coverages within this area, it will vary from state to state, of course, but how does it cover it? So when we look at an agent in a particular market, we want to make certain that we've done the research to see what some of the base coverages are with other programs with whom your prospect or your client may be utilizing. Hearing coverages, we see this as a hearing aid war with some of the Medicare Advantage coverages that are out there. Some of them may have a specific vendor that they go through. However, we are seeing this where it is more of a limited benefit in many markets than some of the, obviously, the dental and the vision benefits, because you access that benefit as a member at one particular point in time, and then you don't really have any help with it for whatever the length of the cycle of that coverage may be with that particular Medicare Advantage member. We want to then do our due diligence, find out what coverages they have for hearing, and then, of course, have they used it or not. It is a kind of a interesting statistic where when we look at some of the folks that in the disabled area, how they access any type of coverages here, because in most cases they don't have any, so they're a great prospect for what we're looking for. We want to make certain that this is, of course, an area where the hearing coverages can really bring to fore some other diagnoses as well. So it goes beyond the audiologist just checking for hearing loss and then looking to sell a hearing aid. Much of what we find is why is their hearing loss can make a big difference, and that can come into play with some other areas of health concern that we have. It also is something that we don't necessarily think of when we talk about hearing coverage, and that's falls. That's the third major cause for admission into a hospital. We do a hospital indemnity plan presentation that goes through some of that detail as well. But when you look at this, it's not clear what the connection is between falling and hearing loss, but a lot of our balance is in the ear. And sometimes we forget that when we talk about falls. Well, gee, maybe they had some problems there. So there are connections that are part of it, and this is one of the ways that we can address that help. And of course, when we look at hearing coverages, diabetes may be affecting the hearing. So if the person's a diabetic, that gives us a way of making certain that they address preventive care in that area as well. Because we look at this, and it goes beyond the folks that we know are diabetic. 8.1 million people in the United States with diabetes are undiagnosed. Well, it may be diagnosed and not actually being addressed as well. And we find through studies that hearing loss and low frequencies can indicate heart disease. So we see a number of different things that will come into play here based on the medical history of the individual that you're visiting with. And if you've gone through and visited with these folks about their base coverages, you become aware of a lot of what they are subjected to, and that gives us the information we need to address it through some of these details that we're providing here today. So how do we produce sales? Lovely, John. You've just sucked up a whole bunch of our day talking about statistics and what this brings to the play. What's in it for us as agents? Well, you've kind of prepped folks in the past. If you've done that base coverage and you use the scope of appointment, which if you're doing MA and PDP, you have to. You don't with Med Sups, but it is a bit of a door opener to additional topics to discuss. When you send that generic form, either through a PDF that you have, through a particular carrier that you work with, or through our Medicare Center program that we'll discuss in a wee bit, it has those additional pieces right in there. The dental vision hearing product, along with HIP, is right there on that scope of appointment. So making certain that during the discussion that you have in setting up the appointment, you broach the topic of, hey, we got to have a scope of appointment ahead of time. Let's discuss everything that's available to you. Boom, there it is. So you have that opportunity to take care of that individual's base needs, but also then address additional products. Now, keep in mind, if you are marketing to someone with just a dental vision hearing product, you don't need a scope, obviously. Well, perhaps not obviously, because it's listed on here. But I would recommend visiting this topic because, well, gee, what did we see in one of the earlier slides? 71% didn't do a review year over year. You may be chatting about that really quickly, and you can set up the expectation before the meeting begins. Of course, if you're in there talking about DVH and they bring up the other portion of it, you can do a scope of appointment and make certain that you can address those topics at that time. It gives us then an opportunity as well to use that Medicare Bible of sorts that we mentioned folks get electronically or hard copy. Having a hard copy with you, it gives you the opportunity, if you're doing face-to-face, of flipping to the page that says, well, gee, here's what's not covered. And we look at this, most dental care, eye exams, dentures, hearing aids. You have 4 topics right there out of the listing that are covered by the product that you are offering that beneficiary. It gives us then also the opportunity to build our T65 pipeline that everyone is pursuing, it seems. Rates for a 64-year-old versus a 65-year-old, that's where we see one of the rate differences on these programs. So if we're looking to address the T65 population, approaching 64-year-olds with this coverage, electronically or through whatever means is compliant for you to do so, it gives us the opportunity then to create a client, and then as they age into Medicare, we have the information we need to approach them on the base programs and other coverages as well. It is, of course, as I mentioned before, an opportunity for us to go beyond the Medicare market. And that's important even in a lot of the Medicare households, because you'll see a differentiation between the ages of some couples sometimes. My father was 7 years older than my mom. When he went on Medicare, that changed the base coverages needs that they had in our household for a demographic that is accessing care more frequently than some of the others. But there are many people 18 and over that need dental coverage as well. And that may include adult children in the household, or perhaps we have a situation where one spouse is older than the other, second marriage, and there are kids involved in that circumstance. We have the opportunity to cover folks outside of traditional Medicare populations. And sometimes it boils simply down to, as I mentioned, that magic question of asking, hey, who do you have your dental coverage with? It's Pepe Le Pew in this, I think now politically incorrect comic, but I still enjoy. You don't get kissed if you don't ask. And it may be as simple as that old Columbo close of getting to the door, turning around and saying, hey, by the way, who do you have your dental coverage with? It is also a great piece of information that you can use in your agency newsletter if you're putting one of those out. Making a piece that is appropriate for the dental, vision, hearing coverage can really, really draw additional feedback through your newsletter. It's one of those hot topics that can really help you grow your book. It is also a piece that you have support through the programs that we offer to contract agents. When you go into the Medicare Center, one of the quoting tools that's in there is CSG. It allows you then to go in and visit with folks on the different topics and quote dental through a multitude of carriers through this piece. So in many cases, some folks will ask, well, what carriers do I need? Let's check it out for your neighborhood, see what's available and how the coverages work. Once we determine that there are different carriers we need to learn more about, gee, this one's got $6,000 worth of benefits, and that might cover the dentures that my folks need. Well, how is that benefit doled out? Because it may not be all available that first year, kind of a walk-in process. So we want to make certain that we're familiar with not only the solutions to the need, but how they work. And that gives us then the opportunity to look at some of the different pieces as to how quickly programs are also issued. Because that, if that's spread out, you know how buyer's remorse can kick in certain circumstances. Doing things electronically can really help the reinforcement of this program, these programs, and also make certain that we can deliver upon that product quickly. Some of the things that you have as well, some of the carriers that you work with, adding DVH, dental, vision, hearing programs to their base coverages is fairly simple. These programs are not underwritten, but some of them may have a network, as the question earlier posed. The network in some of these programs, there may be a passive network that if they went to a dentist in their network, that benefit would last longer because they've negotiated discounted rates for services through their network. But in many cases, you can go to any dentist and walk through the process. They may not fill out the paperwork for you, but you get the bill, you can submit it, you get reimbursed. Because keep in mind, these are fee-for-service programs for the most part that pay in addition to any other coverage that they have. There are also tools that these programs will kick out to help you market dental coverages. A couple of the carriers actually provide a microsite for you to use on the World Wide Web that you can put out there. And, well, you know that whole, if you build it, they will come. There are so many sites on the websites or on the internet. How are we going to make them visit ours? You want to use it as a tool through being promoted through search engine optimization. You can do so fairly inexpensively. You can do your own campaigns on the internet as well. But this creates that microsite for you with that product that if a person goes to it and they enroll through it, it's your customer. It also then gives us that information link that we can put on our own websites if you have one additionally, or in that newsletter, or as part of a tagline in your email correspondence. So folks then can shop it for you and make certain that, hey, they might pick up the need that you hadn't even discussed with them. So once again, you can feature it on your website, and you have an opportunity then to cross-sell with Medicare Advantage and Medicare Supplement plans. And you'll find these tools in Medicare Center. And what it does is helps you understand why someone with Medicare Advantage or would need it. Well, it also talks about PDP. If someone has a prescription drug plan through Medicare, in a vast majority of cases, that's through either no other coverages at all or through a Med Sup. In most cases, you can't enroll someone in a Medicare Advantage plan and then lather on the PDP program of choice. Some programs out there, very few, but this gives us an indication then of how we can sell even with Medicare Advantage coverage. And it works pretty cool.
Thanks for coming on the line with us today. This is John Dubas with another Premier Marketing Moment.
And there we go. My lovely video. One of the things cross-selling does do for us as well is it, as I mentioned, creates the opportunity to strengthen our business across the board. Your asking the question helps build that client relationship and helps keep that person on your books. And it can be a very simple way of asking. You know, gee, anytime you go through a fast food lane, they have the opportunity to ask you, hey, do you want fries with that? Do you want a meal with that? Do you want to upsize that? That upsize question is there all the time. That simple one question. You don't have to be really deep into the topic because they may not need it. You may not. Depends on, did you do the fact finding during your presentation? So it gives you an opportunity then to sell it as standalone only. And it gives you then not only that additional client retention, differentiates you from other agents that aren't visiting about the topic at all, and you know your clients need it. That little giggity up for you is if you did one sale a week with the vast majority of these coverages, that's an additional $13,500 into your pocket. So that's a good incentive for us to just ask that one more question on a demand product that is not underwritten, that you can do very quickly, you can do electronically. They want you to do it electronically, and it provides you with tools to help sell it outside of your own marketing activities. Man, got to do it. When we look at the carrier options that we offer here at Premier, and there's a ton of them. We recently brought on a new one as well, but this gives us then the ideas as to, well, gee, do I already have a contract with some of these companies? Is this a separate adjunct that I need to add to it? How difficult is it to become contracted? How difficult is it to perhaps to add that as part of my Aetna or Cigna or whatever other coverages, my Medical Mutual of Omaha programs that aren't currently in my portfolio? That's a great way to just add some different things that won't cost you anything additional. You know, we have those different appointment fees in certain circumstances, but this, if it's adding to your current contract, it's not an additional appointment fee. Generally, for your home state, they don't charge you that fee either. So, but that gives us then the opportunity to go back to that MedicareCENTER comparison for an individual, plop in some different parameters as to what you want in that policy and see how it shakes out. And then we have the opportunity to look at some of these carriers as a viable contracted partner. However, not all of them offer that website. So we want to make certain that, well, gee, then we want to look at those companies specifically that can help us with that marketing tool at no cost to us. So we also have to remember that we need to be flexible yet consistent. How are we approaching the topic? Because, you know, it's the old Mike Tyson quote of everybody's got plans until they get hit. Well, one, are you asking for it consistently, which is a big thing that you need to do? And then two, how are you asking? Perhaps there are different ways of doing a simple question and answer type of needs analysis with it, or it could be that, hey, one more thing as we walk out the door. We got to remember that this is a way to draw additional revenue, but it's important not for us to put all our eggs in one basket, because some of those carrier partners that we talked about, well, they may have different marketing campaigns that you can use that can help in this area. And depending upon how you look at some of these carriers as well, we got to realize one size won't fit all. So how do we get in front of them? Well, you can still cold call for dental. You can door knock for dental. There are things that we need to do, however, in both those circumstances to make certain that we stay compliant. Because if you're cold calling, is that list butted up against do not call? And it differentiates you from anything else. I am not on Medicare yet. And I get calls constantly, as I'm sure many of you do, from different marketing organizations offering different programs, but it's always we have a new Medicare product for you. Totally out of compliance. The calls, I listen to a lot of them, try to find out who they are, but this is a topic that's not being beaten to death through that means of outreach. There are also different things that you can do within the community. So dental coverages is a great topic for webinars and seminars through some of those different centers of influence within our community. So that gives us an opportunity to have another topic to approach folks for in that area. And within provider marketing, you'll find that some of the carriers in the dual special needs product, they have a campaign to approach dentists with their support. So it's something we need to look at when we look at community-based marketing approaches. Carrier programs, I mentioned a little bit about that DSNP part of it, but the carriers themselves with the dental programs, the DVH programs, they have marketing campaigns that can help you. So when we look at and we select a carrier, we want to make certain that those programs can help us, and it may be as simple as giving us direction on what we can use on social media. Doesn't have to be fancy then. So you can slap that bad boy into a post through an approved piece. You don't have to recreate the wheel. You don't have to try to take all that time to do so either, and make it work. We talked about direct mail and how that can be effective for this topic as well. We'll briefly discuss referrals and the T65 locator, and a piece that's not on here, which is the lead center through Medicare Center. We look at the opportunities that we have with dental. It can be through a number of folks that provide services under the Medicare program. But you look at dentists, generally, we talked about the dearth of coverage that someone has with just traditional Medicare. Approaching them with a program that can help their pending balance of what's due to them, well, it's a receptive bunch, generally. So we need to make certain that we're asking when we prospect, when we sell, and we do our follow-up. By the way, who do you have your dental insurance with? By the way, who's your dentist? Can be very simple questions that bring up the topic and get the discussion rolling. Why do you want to do some of this stuff with us here at Premier? Well, we're going to make it simple for you to contract through multiple carriers. You can create your agent profile here and then click on a carrier, and they'll create an electronic link for you in most cases. Gives you the opportunity then to review that portfolio and say, hey, I really need this carrier, but I need these 3 other ones as well. How quickly can I do that? Keep in mind, the contracting process for these are very simple, and it doesn't require any certifications. Doesn't mean we don't want to study on the topics, but no certs are available or necessary to contract. We also want to make certain that we are covering your financial wherewithal through discounted E&O for a qualified agent. There's an admissions coverage for me. How do I become a qualified agent? You have a contract with us? That's all it takes, one contract. But it's a program you own. So it's not being added to a blanket E&O for just one topic, and you have to search for coverage for other programs with whom you contract. Premier's huge. Portfolio's large. We don't offer everything everywhere. I don't know of anybody that does. And I've been in the business longer than I care to admit anymore. It's a great way for you to make certain you have the coverage you need to contract, not just with dental programs, dental vision hearing programs, but also other programs that you search for and you impart as part of your own portfolio of product offerings that you have. We want to make certain too that we help you keep your license in play. So we have discounted continuing education through our partnership with WebCE. As a independent agent, you're responsible for your own benefit package. Well, you can actually have a modified guarantee issue disability income plan for yourself on which you're paid a commission as well. I mentioned that today's presentation is being recorded. Past presentations have been as well. They are on our website and on our YouTube channel. But this gives you then the opportunity to look at, gee, I got a great new dental program. How can I market it within the community? We have pieces there that help you address grassroots marketing to centers of influence in your community. There are also on these sites past presentations that we've done with some of the carriers that explain the program specific for that carrier, which of course you need that information. We schedule them pretty regularly, but gee, you went through that list again. Gee, Don, you got a lot of them. We don't do them with everybody, but that information is available to you for everyone. I cannot overemphasize the access that a contracted agent has to Medicare Center. It gives you that opportunity to log into multiple quoting engines. So your base medical programs there, Medicare Advantage, PDP programs, and MedSup is there. As I mentioned too, working through the CSG component, one of the quoting tools, it gives you that opportunity to do that dental coverage as well. Since they do not require the scope of appointment, but we've talked about why you want to do it anyway, because that gives you the opening for other topics. It gives you then the way to collect that and store it for that 10-year period. It gives you calling, recording, and storage as well. You don't have to record a call for dental coverages, but we want to make certain that if that discussion begins, we stay compliant, we get it recorded. It gives us then that opportunity to send out side-by-side plan comparisons. This program also gives you a personal URL. So we're talking about how those pearls, those microsites are available through certain carriers. There's one available to you through this program as well. Pretty easy to set up. Another way of putting a face on the internet, and another thing that you can put in your correspondence through your newsletters or through general email that you send to folks for one reason or another. It does have a CRM, a contact management system within it, so you can go back to folks that you've talked to in the past and offer the product. It also gives you within that CRM switcher tags. These are folks that are more susceptible to a change. Are they looking for additional dental coverage as part of that emphasis for switching? It gives you a way of prioritizing your activity as well. We'll talk about Lead Center in just a second, but there's also within this program the opportunity to go to the Learning Center and become better at offering a specific program or addressing it. So those resources are available within Medicare Center too, and it is available as a mobile application. It's also, to quote one of those quasi celebrities on television hawking the different Medicare Advantage plans, it's free. There's no cost to agents that are contracted with our organization or our platform partners. It gives you then that opportunity to quote right through that program and make certain that if it's with a carrier that's offering additional incentives as well, because they do that periodically with dental programs, it helps you qualify for their trips and for our incentive programs as well that include a return of the producers convention, which has been on hiatus because of the pandemic. We want you to be able to use these programs to help qualify, because look at that. Third factor there is DVH. Some of the things we'll do to make certain that you have the help that you need, broached on this earlier to a degree, but it is an opportunity to help qualify for the lead co-op for health products. Drives down that cost so you can do it consistently. And hey, if you're offering final expense as well, an additional opportunity to help with those costs as well. We do so through preferred lead vendors. These are companies we vet to make certain they have the systems to deliver any lead that's generated very quickly. And they do so in a fashion that is compliant for you as well. We do also offer direct mail leads through our partnership with this organization that gives you access to never distributed direct mail leads as well. That may include the Medicare programs or that are pretty darn fresh, or some of the older ones that are discounted, but give you an opportunity to speak to people across the board. Now, keep in mind, if you're out reaching out to people about Medicare programs, and most of the folks that do so speak to the base medical, well, that may well be an opportunity for you to also speak to the dental coverages. Because, hey, you got somebody who lifted their hand, they may not actually want to change coverage after a discussion. Doesn't mean they're not a prospect for dental, vision, hearing programs. We do offer also Facebook leads in a couple of different areas where in this particular program, they're set up for final expense and Medicare plans. I want to make certain for you to realize, however, hey, the internet is a great way to get leads quickly. It's also a great way for them to expect responses as well. So you got to be on your feet if you're doing an internet lead campaign that includes a new partner that we brought in that deals with search engine optimization leads. So these are folks that are raising their hands in different areas and be a hot lead for you. Lead Center, it's part of Medicare Center, but there are systems within that that give you the opportunity to create and purchase leads there as well. Could be live transfers, could be data just put in your CRM. Either way, it's a great way for you to manage your budget and the capacity you have to address a lead. Because keep in mind, the longer it takes for you to reach out to them, the cooler that prospect gets. So this is a great way for you to make certain that your calendar is full through multiple parameters that you set as to how much you want, when you want them, how much you want to spend. That T60, pardon me, froggy there. That T65 tool, that's something you download to a smart device. They make certain that you have a contract with us, but then it gives you the opportunity to put in different parameters and find out where some of these people live. So if you've got perhaps an area where you stacked appointments and one of them cancels, you can pull this up, pick out 64-year-olds, remember that, and door knock. You can do that legally. And it's a great way for you to drum up leads in an area that you're already active in as well. That referral program, it is a circumstance that not only helps you take one lead and grow it, but it also gives you an opportunity to revisit your book, go back to that CRM program within Medicare Center and work through it and say, hey, Mr. Client, appreciate you trusting me with your base medical coverages. I've got a new dental program. I think that's a great help to a whole bunch of folks. Do you know other people in your social circles that could use such help? You're asking not for them to buy, but for them to recognize other people that may need dental coverage. And it then may turn into the fact that, hey, I'm the one that needs dental coverage. So you're engaging your book as well. We do this because we want an opportunity to work with you. We want to be part of your referrals to other agents that you speak with. And we want you to realize that this is something that you can make happen quickly. Contracting's quick. Adding it to your personal marketing plan then gives you the opportunity to discuss this right away. So you have a means of adding an additional line of helpful marketing programs within your personal marketing plan. Now I'm going to check really quickly to make certain that we covered all questions. I believe that we have. So at this point in time, since we're nearly at the top of the hour, I want to thank you for coming on and visiting with us. For those of you that are contracted with Premier and have done business with us in the past, I thank you for that business. I look for programs such as what we're discussing today as a means to enrich that relationship. For those of you that aren't contracted with Premier and are looking at this as, what do you got? Well, I welcome the opportunity for our organization to earn your business. But for all of you that have come on and taken the time to devote part of your most valuable resource, that time, and watch this presentation, become part of it, thank you for that as well. So what we'll do at this particular point in time is wish you good selling in the future, and how we can be of help to you. Well, please, we want to reach out to you as well, but that's our toll-free number, and you have our website where you can request information through that as well. So until we're able to visit again, I do wish you that good selling. Thanks so much.